My guest this week on Let's Talk About It is none other than Honorable Gordon Tapper. Mr. Tapper is the president of United African Congress and co-founder of Give Them a Hand Foundation. He's also a former United Nations Chief of Section. Also, I have Stephanie Evans, who is the director of Give Them a Hand Foundation. Lady, gentlemen, welcome to Let's Talk About It.
Thank you.
Thank you very much, my friend.
Thanks.
Pleasure
Thank
to be
you.
here.
Thank you. So you have an opportunity to listen to my earlier conversation regarding Africa. What is your impression of the statistics provided and the resources that's frankly available in Africa?
Well, there's no question that Africa is the future. I see Africa as the future. And I believe most of the international agencies, organizations are positioning themselves to capitalize on this great future that Africa holds. When you refer to the percentage of diamonds and gold and minerals and platinum and rare minerals that Africa possesses, and the percentage of arable land, and the fact that Africa is the youngest continent, and many people don't know it, but there are many brilliant scientists and doctors and professionals out of Africa. And there's a brain drain. A lot of these people are in the United States and in Canada and in Great Britain and in France, and Belgium, etc. But there's a lot of talent that has been taken out of Africa. Not only talent, like I said, these are the resources. I think one of the main objectives, or one of the goals that Africa should be focusing on, is taking control of their resources. Over the years, Africa has produced but not benefited from what they have produced. Other people, other countries have benefited from that, and it is something that we have to address. I don't know if you're familiar with Ambassador Chihombere, who was the previous ambassador of the African Union to the United States.
Right.
And she was one of a webinar that we hosted, and she spoke very strongly about the relationship between France and the Francophone countries, in which she felt, and I believe most Francophone people actually do feel, that they are not entirely without the influence of colonialism in that relationship. And she was also very adamant that China had a lot to account for in their relationship with Africa, and of course the coronavirus. But we're very much, we believe that Africa is open for business, but not to be exploited. What I would like to see is the diaspora, Africans in the United States, Africans in Europe, all over, invest in Africa and help to turn things around and help Africa to own its resources.
Now, Stephanie, so you prefer Ms. Evans?
Yeah, that's fine.
Okay, all right. I mean, it's I spoke not too long ago regarding economic recolonization, which is what Gordon is alluding to. Knowing what we know, knowing what Africa had, what is the problem? Why does this problem still persist?
It's very interesting because, as Gordon was talking about, we did a series of webinars alerting the situation to the coronavirus. And one of those webinars that we did was on the economic impact of the coronavirus in Africa. And you alluded to some things I think that are very important. Africa has the resources. It has. Some good example, for example, is it has aluminium. But the alumina is mined and it's taken out. And then the major companies then sell those cans back to Africa at twice the price, right? And I think that as Gordon talked about, it's very important that Africa harnesses its resources, its diamonds, its minerals. It's rich. It has a young population. But the impact of colonialism is that colonialism took all the resources. And then when independence occurred, countries were left without the knowledge and the information as how to manage themselves. As a result, it gave the opportunity for the new leaders coming in to really mimic what the colonial environment was of the past. And I think what's important with a young population, as Gordon has talked about, it's very important for us to train, to harness the knowledge, especially in the sciences and in technology, so that we can mine our own minerals, we can get the resources, we know what to do with them, and we can also invest back in our community. And I agree with Gordon, it's very important that the diaspora as well contribute, because there are Africans all over the diaspora who have done well and need to look back and give back to their countries to enhance. It's sort of that return to Ghana, you remember that just occurred recently.
Right. That's right.
So literally we have to have a return to each country where the diaspora helps to contribute to make sure that the economies are shored up. In doing these COVID-19 seminars, it was amazing to realize that, as you said rightly, Africa has all this arable land that they could feed themselves, but most of the food is imported, and that supply chain was impacted in the COVID-19 pandemic. And so we had food insecurity all over Africa when we have arable land and people were not farming. So one of the things we did was we had a seminar on agripreneurs, young people who are using technology to be able to return to agriculture. And those are some of the solutions moving forward.
Isn't it possible, that the West, the former colonial powers, are still, very much influencing how Africa gets to operate, even so on this modern day? And if so, what are the angles that the African leaders can explore in order to make sure that they break from this, hold from the colonial, masters, so to speak?
Well, I'll be very frank. There is also the matter of governance, of poor leadership, and the idea that many leaders, what is in it for me? How can I secure the future for myself and my family after I have left office? How can I make a deal with that company, with that investor, for me to benefit? I'm saying all of this because I don't want to use the word corruption, but it is a factor. One of our African billionaires had put up, had offered to have, on an annual basis, any leader who leaves the country, leaves office, peaceful transition, would receive a large sum of money, millions of dollars. And on one or two occasions, he was able to do that. But he has not yet been able to do that over the last 5 or 7 years. So it says something. You're probably aware that Sierra Leone won the Millennium Challenge Fund over the last month or so. And one of the reasons why they got this, and this is about worth as much as $300 million from the Millennium Challenge Fund to Sierra Leone. One of the reasons why they got it was because the government tackled corruption in a very transparent and credible way. It is difficult to get rid of it completely, but there has to be the will to fight it. And what I'm seeing is there's a change, there's a generational change. Young people today want more. They don't want to see their country being devastated, being used in this way. And I think we are gradually seeing this change, where they're holding their leaders accountable, and that should continue.
Right.
But if I should just go back to one of the things that Stephanie said about entrepreneurship. A very fascinating thing, something that we discovered in one of our webinars. There was a young man who was in the Rift Valley, a Maasai, and he started agriculture, farming in his community. I don't mean cows, I don't mean cattle or goats, I mean growing crops. And that was something that is not a part of the culture of the Maasai people, because they move from one place to the other. And this is something he initiated. It is successful now. And they use drip agriculture, drip irrigation, because there's no, it's an arid area. And that is some of the things that young Africans are doing, innovating. And that has to be encouraged. We all need to encourage those innovations.
Yeah, and I'm hoping the leaders, are listening, and I'm hoping they give them such opportunity to farm. The mechanized, farming is the way to go.
Mm-hmm.
Now let me, come back, real quick to the subject of Africa Rise. Africa Rise is an organization you want to, tell us about?
Well, Africa Rise is a coalition of groups that have come together. As we talked about before, we had a series of webinars where we were alerting everyone to the impact of COVID-19 in Africa and what that would mean for Africa, having another pandemic upon the other epidemics that were there. And so as a result, we realized that there needs to be more done than just sending PPEs or sending gloves or sending that, because that was just a band-aid for the system, in that most people did not have adequate, in some countries, access to health care. The deaths for children under 5 were very high. Maternal child health did not meet the SDG goals. There, in some countries it's getting closer and so on. And so, but at the same time, in Africa, we have the highest cell phone penetration, the highest use of cell phones. And you could be in the most rural area and someone has a cell phone. So the thought came to us, what can we do to have an impact in the rural underserved areas? And what we thought of, why don't we do something over a period of a couple of years to make healthcare more accessible? And so a coalition of groups, including the United African Congress, Give Them a Hand Foundation, came together to say, why don't we provide mobile clinics in the rural underserved areas? And also utilize the cell phones to bring the doctors to the rural areas. Women have to be traveling miles for basic well baby care, for maternal child health, and all of these things. And also connect them to the larger hospitals that exist so they could go. Because people die from things that are curable, that there can be interventions. Child health and outcomes need to be improved. And so the coalition of groups came together and decided, let's do a fundraising event that would then be able to help us to purchase mobile clinics in those rural areas that could give that access to care. So that's out of that came Africa Rise, Healthier and Stronger.
Healthier and Stronger. That's a good mission. And I believe is it something that's already started in terms of implementation, or this will be the first the beginning of it, or what is it?
So accordingly, you might want to.
This will be the beginning of it. And the way we see these mobile clinics operating, they would be linked to a hospital, an urban hospital or so. And they would go out. On Monday, they would go to village A. On Tuesday, to village B. on Wednesday they would see whatever, and they would go back to the urban hospital. They would get their medication, maybe a new doctor, a new nurse, or whatever. Maybe their X-rays or whatever they need to read and come back. But the village people would know that every Monday the clinic is going to be here, and if I have a problem, I can go to them and have myself looked at. If there is a major problem, they can be referred to the city hospital, of course. But they should have the ability to do X-rays. We had an event, or should I say, a mission near Midway in South Kivu in Democratic Republic of the Congo, where the community, they came to us, and we put together this program to help to create some employment and to address the COVID-19 pandemic that they were scared of. Midway is a mining town and very active. And we had a group that's on the ground called Open Health Vision and medical doctors in the community. We put together the program. We hired women to make masks because there was no money. We needed to put some money in people's hands. They made masks. We distributed thousands of masks into the community. We installed hand washing stations, and we created some infographics teaching people how to use good sanitation measures and to help build their psychological resilience, which is very important. People are scared. The amazing thing is, after about a month and a half, 2 months, they had a ceremony in one of the facilities in which they congratulated and thanked us for the work that we did, because it resulted in them not having, or having very few incidences of infection, which was good. The infographics that we created are all over South Kivu and North Kivu. They are in the buses, they're in the marketplace, they're all over. And I must give credit to one of my colleagues, who's Dr. Julie Koryansky. And she is a professor of psychology at Columbia University's Teachers College. We work together. Dr. Mohammed Nur Hussein, Ambassador Sadiq Wai, who we referred to. And we're all a part of this that developed that program. And why they contacted us, because we had an arrangement with the University of Butembo and the University of Beni in DRC, where we were going to be teaching courses on psychosocial issues, on sanitation, on community engagement, in all of these areas. And during the period of the Ebola, which was 2018-2019 in DRC, the international agencies pulled out. The United Nations, even Médecins Sans Frontières pulled out because of violence that erupted, and the mission that we had started halted, even though we still plan to go back there. So from halting that mission, some of the people knew what we were doing, and they invited us to help them with COVID. So we just transferred to COVID.
Okay. That's good. Commendable efforts. I hope you continue.
Thank you.